Does masturbating protect your prostate or damage it? The internet shouts both answers. The best long-term research actually surprised a lot of urologists. In the next few minutes, I'll separate myth from evidence so you know what's protective, what's neutral, and which warning signs you should never ignore. Stay with me, because the last point is the twist most men miss. I'm Dr. Layla Anderson, a urologist, and I spend my days helping men with these exact issues. My goal here is to guide you with clear, authentic information you can trust and apply in your own life. Let's start with the big fear: cancer. The strongest signal we have comes from the health professionals' follow-up study out of Harvard. In the original analysis published in JAMA and in an updated analysis in the journal European Urology, men who reported ejaculating more frequently, roughly in the most days of the month range, had a noticeably lower chance of being diagnosed with prostate cancer later on, compared with men who ejaculated rarely. That's an association, not proof of causation, but it has shown up more than once in high-quality data. In simple words, frequent ejaculation does not wear out the prostate. If anything, the big population studies point in the opposite direction. Why might that be? Think of the prostate as a factory that makes fluid. Regular emptying may reduce the time waste products sit in the ducts. There are also plausible hormonal and local immune effects. Those are working theories, but they match the pattern seen in the Harvard cohort that JAMA and European Urology reported. Now, what about enlargement and night urination, BPH, and those frustrating bathroom trips after midnight? This is where online advice gets loud and wrong. The American Urological Association's BPH guidance emphasizes age, hormones, bladder behavior, and lifestyle factors. Ejaculation frequency is not listed as a cause of enlargement. Studies that look directly at ejaculation and urinary symptoms are mixed. And when you account for age, many show no meaningful link between how often a man ejaculates and how big his prostate is, or how weak his urinary stream is. A few analyses hint that more frequent ejaculation might correlate with fewer symptoms, but that's not consistent across all studies. The safe takeaway: masturbation doesn't cause BPH. For most men, it's neutral. Night urination is usually driven by prostate growth with age, bladder sensitivity, fluid timing, sleep issues, and sometimes medications. Prostatitis and pelvic pain are different. In men with the NIH-defined chronic pelvic pain syndrome, what many call non-bacterial prostatitis, long gaps without ejaculation can make some symptoms worse. Older clinical reports and reviews referenced in urology texts like Campbell-Walsh-Wine Urology note that regular ejaculation can reduce the sense of pelvic congestion for some patients. It's not a cure, but if your pelvic heaviness eases after ejaculation and returns with long abstinence, that's a useful clue to discuss while you and your clinician rule out infection and other causes. So, if the big fear is cancer, the best evidence leans protective, or at least not harmful. If the concern is BPH and night urination, frequency looks neutral for most men. And if the problem is pelvic pain, a steady rhythm often helps. That answers the headline question, but daily habits still matter. Some patterns help your prostate and sexual function. Some quietly make things worse. Helpful patterns first. Regular but comfortable frequency that fits your body is a good baseline. There's no magic number per week. What matters is avoiding irritation and matching your energy, hormones, and relationships. Hydration timing matters more than people realize. Concentrated urine is spicy to the bladder and the prostate. Front-load fluids earlier in the day and taper in the evening, so your bladder rests at night. Behavioral advice you'll also see reflected in AUA guidance on lower urinary tract symptoms. Light daily walking supports pelvic blood flow, which helps both urinary comfort and erections. Boring, yes. Effective, absolutely. Now the traps that quietly cause trouble. Excess friction or very dry technique can create microirritation. If you notice soreness, burning, or tiny streaks of blood in semen or urine after a session, reduce friction, use a better lubricant, and give the tissue a short rest. Pain that lingers beyond a day, especially with fever, chills, or burning when you urinate, needs a proper check. Don't push through that. Another modern trap isn't about the prostate at all. It's about your brain. Very intense, high-novelty porn can desensitize arousal pathways for some men. You may notice you need more and more stimulation to feel anything, yet real-life sensation feels blunted. That isn't prostate damage. It's a training effect. The fix is usually a few weeks of dialing down intensity and letting your nervous system reset. Switch to gentler, responsive stimulation, reduce novelty, and sensitivity often returns. Age-smart expectations also help. As men pass 50, semen volume often decreases and the sensation profile changes. That's common with BPH and with some medications. Don't confuse those normal shifts with damage. If you ever feel unsure, that's a good reason to get a simple checkup, not a reason to panic. Let's talk about the red flags that should prompt a medical visit. Visible blood in the urine or semen that keeps coming back. Fever, chills, burning with urination, or struggling to pass urine. New severe pelvic or back pain. Unintentional weight loss, bone pain, or persistent obstruction. Those are not wait and see. They need evaluation. The usual workup is straightforward. Urinalysis and urine culture, kidney function tests, PSA when appropriate, and imaging such as an ultrasound. Depending on age and history, your urologist may also look inside the bladder again. Standard care you'll find in AUA guidelines and major textbooks. Now the question everyone asks, so what's a safe number? There isn't one perfect number that applies to every man in every decade. Hormones, medications, stress, relationship context, fitness, and sleep all change what's right for you. Here's a sensible way to think about it. If you're comfortable, not sore, not seeing blood, not noticing increased pelvic pain, and your energy and mood are steady, your frequency is probably fine. If you feel sore, irritated, or more symptomatic afterward, dial down, give it a few days, adjust technique and lubrication, and check your hydration and sleep. If you have pelvic pain that improves with ejaculation, then returns after long gaps, a steadier rhythm may help. And if anything on the red flag list shows up, get checked and let a clinician guide you. So put it all together. Masturbation doesn't damage the prostate. For most men, it's either neutral or modestly protective. And the real focus should be on lifestyle, red flag symptoms, and regular checkups. If this video was helpful, please like, share, and subscribe. It really helps more men find trustworthy health information. And tell me in the comments, what's one men's health question you want me to tackle next?